It's 4:15. You made it. It's been a long and intense day, lots of great information. And thank you guys for hanging in for this last and what I and I know many others in this room consider a really important aspect of this workshop, which is a survivors panel. It's always um, it's interesting how often we get in the rooms and start talking about things to do for patients and we neglect to actually bring the patients into the mix. And so I'm thrilled with the fact that there is a survivors panel and that we're giving them this time to speak and to tell their stories. I would also encourage all of you to use this opportunity to ask questions. We were talking on the break earlier, and they were saying, I'm here. They should ask me all these questions, these things they're talking about, and how do we get young adults for this? And so they're here, and they're willing and ready to offer their thoughts and opinions and suggestions. So please take advantage of that. We're going to take. Sorry, I'm Heidi Adams. I'm the president and CEO of Critical Mass, which has been discussed a few times, particularly this morning. I've been in the young adult cancer world for a long time. I just calculated it out on a piece of paper before I walked up, a 20-year survivor of Ewing sarcoma um, when I was in my mid-20s, so you can figure out how old I am now. But we have three great survivors on our panel here. Their stories are very enlightening, and I think in many ways what the survivor stories do is highlight and bring to life a lot of these issues and these challenges that we talk about in the abstract or in the numbers, and it really puts a face on the numbers. So I won't take up too much more time, but just to say, Holly and Chris and Ben, thank you so much for being here. They're going to take it in turn to tell their story. Then I'll start out with a few questions, but then obviously we'll be taking questions from the audience as well. So I think this will be a great close and a great end to a really good first day. So Holly, you want to get us started?
Thanks, Heidi. First of all, thank you guys for having me and having all of us. I think it's a great opportunity for all of us. My name is Hallie Farrish, and I was diagnosed in 2005 with Wilms tumor, nephroblastoma, at the age of 25. And in 2005, I had never heard of AYA. So thank you all very much for all your research and the amount of information that I just learned here today about AYA, about where cancer has come and where research is headed is truly amazing, and I'm very fortunate for people beyond us as well as ourselves that it's a really great stride, I think, for all cancer patients. So in 2005, I was originally diagnosed with renal cell carcinoma with metastases to the lungs, and my treatment plan was to join a clinical trial at NIH. I had a right nephrectomy, and the pathology came back and said that it wasn't renal cell carcinoma. It was actually Wilms tumor, which is extremely rare in adults. So that kind of threw my plans off place. I went back to my oncologist who had originally diagnosed me with the renal cell, and she was quite surprised. She was an adult oncologist, and I think we were both quite surprised because I'd never heard of Wilms tumor, and she had never treated it before. So that put me in a kind of a flex situation where she said, I'd love to treat you. I've never treated this before, but it's a great opportunity for me to, I'd be happy to do this with the help of Children's Hospital, with the National Children's Medical Center in DC. And I really liked my oncologist, and that was really important for me to, after hearing this diagnosis, I really wanted to have that kind of relationship with someone I trusted, someone I really liked, instead of getting, I don't know, in a sense, punted to Children's when I was really 25. So at that point, it became, it's either Dora the Explorer or AARP, right? Do I go? She gave me the opportunity to go to Children's, but she also said, or you can stay here. So either one, I was still in flux in the middle because it's either Dora the Explorer or you're reading the AARP Travel and Leisure. At 25, you're trying to go to Key West for spring break, not go to chemo at Children's. Either way, I ended up choosing to stay with her, and she worked wonderfully with one of the doctors at Children's, and they made a great team. It turned out to be a wonderful and positive experience for me. The entire treatment protocol. We followed everything that Children's did. They just adjusted it to the Children's Oncology Group protocol. They adjusted it to my weight, and it was kind of a learning process at first, how I was going to respond and how I was going to respond to treatment, because children's protocols are generally children are a lot more resilient. They bounce back a lot faster. I didn't bounce back quite as fast as we had hoped, but it works wonderfully, and I'm cancer-free. That said, I've been cancer-free since the end of treatment, which was 28 weeks, and I learned a lot, an immense amount. I've learned a lot today, but when you become a cancer patient, you become like quick learn. It's like trial by fire and fire hose. I wish I'd paid better attention in high school. I wish I'd paid better attention in college about blood cells and white cells and what everything does, because at 25, it's really not at the forefront of your mind, and you're not thinking you're going to be doing these things. You're thinking about getting married and going to your friend's wedding and getting a job and having kids and buying a house. And at that point, you're not thinking about any of that anymore. You're thinking, I'm going to die, and this is going to suck, and how am I going to pay for this, and what am I going to tell my parents? And all these different things start coming into play. Some of the big things that came out that I learned with my treatment and going through it was, one, it turned out to be, I think Dr. Zebrak mentioned it earlier, that there's a lot of positive that comes out of it, like a positive attitude. It was probably one of the most positive experiences of my life. It sucked, but it was really, looking back, it was wonderful, and I wouldn't change having cancer to not having cancer, because it was that much of an incredible journey. But it's a journey that needs to change, I think. I think that's why we're all here, is seeing how we can make changes to make it easier, to make it better, to make you not feel left out, not feel alone. Some of the issues that came up for me were fertility, Social Security, late effects, and just trying to choose between pediatric or adult. Ultimately, I told you I did, and it worked great with my doctor. When my doctor was on vacation, it didn't work so great, because the other doctors in the practice weren't as open to actually reaching out to Children's and saying, what should we do here? Her counts are really low. I was begging for treatment, and he was saying no, and I was saying, but my oncologist will give it to me. Just call Children's. They'll tell you it's fine. Just do it. And he said no. And at that point, you want treatment. I didn't want to stop. Ultimately, in the end, he was probably right. I got admitted like the next day because of my counts. But his resistance to actually reaching out and asking for help to try and understand the children protocol, it wasn't there like my oncologist was. So that was difficult. I don't want to take up too much more time discussing myself, so I'm going to pass it on over.
So Holly's going to be a tough act to follow. I'm Chris. I was 28 when my tumor was accidentally discovered in an emergency room, and it turned out to be papillary thyroid cancer, papillary follicular variant thyroid cancer, and papillary microcarcinoma. Overachiever I am. I had 3 tumors. I had radioactive iodine treatment against my will. It did not work, and I have been living with residual cancer for the last 5 years. And because of that, I still am in the hospital once or twice a week, managing the long-term side effects. I just had an emergency MRI on Friday before I flew out. I've developed insulin dependence, not diabetes, but I am insulin dependent. I have a heart condition. I'm tachycardic. I have premature ventricular contractions every 3 minutes. I'm on Alzheimer's drugs because the brain fog is so bad. So there's this stigma that it's a good cancer, but it's really not. No cancer is a good cancer. And it doesn't, especially for young adults, it isn't as quick as treating it and it goes away and life goes back to normal. There are many of us who are still managing these side effects and will for the rest of our lives because we're younger. And there are studies coming out there showing the younger you are when you get cancer, the more likely you are to have a recurrence. Like they're showing thyroid cancer comes back after 20 years. We didn't know that before because it used to be an old person's cancer. So it was really exciting to actually see all the thyroid cancer stuff today, and I really appreciate that because normally unless you're in an endocrinologist's office or in an endocrinologist meeting, no one talks about thyroid cancer. So that's been really great, and it's very difficult, I've noticed, to bridge the gap between oncology and thyroid cancer because it's an endocrine. So I never saw an oncologist. I didn't have that kind of care with the social worker and people guiding me along. It was my surgeon, my nuclear med tech, and an endocrinologist. And that was it. So, I'm envious of Holly, who's cancer-free, and everyone else I know who is, but I have good company. It's been a very positive, life-changing experience in the end, and I've met wonderful people and had great opportunities, and thank you for letting us be here today. Ben?
Good afternoon. My name is Benjamin Rubenstein. You can call me Ben. I usually go by Benjamin on the phone because people think I'm saying Brad or Brian, so it never works out saying Ben. When I was 16, I was on the tennis team in high school, and I felt pain in my hip, and I pushed it aside for about 6 months. I finally saw a doctor, and I was diagnosed with Ewing sarcoma. Went to NIH for treatment, which included 14 cycles of chemo, 5 weeks of radiation, and removal of my left ilium. I became cancer-free at the start of my senior year of high school, and then at the 18-month restaging mark, just part of the protocol, I went back to NIH, and they discovered I had very low platelets. So over the course of the next month, they tried to find out what it was, and it was myelodysplasia. So I went to the University of Minnesota and received an umbilical cord stem cell transplant. And then that was my first year of college at University of Virginia, so I took a year off. I became cancer-free, survived the transplant, went back to UVA, got my degree, and that was a long time ago now. That was 2003. The myelodysplasia, Ewing's was 2000. I just want to touch on, somebody had presented on fertility earlier, and I have a firsthand account which I describe in detail in my book, but I don't use the same technical terminology.
I'm not going to ask you what terminology you use, but I do like the slide that was shown earlier. Um, so I know, I've heard all of your stories in great depth, so I want to bring out a few more of the issues, particularly as your stories relate to them. But I want to start with, where we started first thing this morning with the panels, where we talked about raising awareness and moving the needle on awareness has been a major area of progress in this field over the last 5 to 10 years. So all of you started, this journey at least 5 years ago, some more. And so I'm curious, one of the things I'm curious about is knowing there's been progress in the medical community, but how much of that has actually trickled down to practical day-to-day for patients. And so I'm curious whether you, in the course of your journeys, if you have noticed any changes over the course of time, noticed more awareness of your unique sort of issues and challenges as young adults going through this process with your healthcare teams.
Chris just called me a veteran. I appreciate that. So I was diagnosed when I was 16 in the year 2000, and I was treated as a pediatric, and even 3 years later for myelodysplasia, I was treated on a pediatric floor. And actually, I'm still treated in pediatrics at the Children's Northern Virginia campus. I'm kind of wondering if I can be the first 50-year-old to still be in a pediatric center. But I have noticed an enormous amount of AYA awareness over the past few years. I remember I first heard about it at a GW conference 2 years ago when they discussed Thriving After Cancer, their program, which I think Holly is in and she can discuss in a bit. And I strongly consider switching over, but I'm sort of tied to my doctor. I think she's awesome, Dr. Jennifer Dean. I think she may be moving to TAC, and if she does, then I'll probably join her and forego that big 50-year-old trophy I was going to get.
I guess I'll speak a little bit about TAC. TAC is thriving after cancer, like Ben said, and it's basically a program for adult survivors of pediatric cancer. I've kind of made the mark being an old person with Wilms, but they let me in anyway. And it's basically a very comprehensive program that analyzes all that you see an oncologist, you see a primary doctor, you see a psychiatrist, you see a nutritionist, you see every gamut that possibly can be met that helps you manage, and they look out for your long-term after effects or late effects. Every year they have created like a amazing program where they have your survivorship plan geared towards people that had cancer, because I don't think your primary care or a primary care on a regular basis for a young adult with cancer and after cancer is going to know to prescribe or send you for an echocardiogram or an ultrasound or whatever, or a pulmonary function test because you had chest radiation or because you had this type of, a chemotherapy agent and the one adriamycin that affects your heart. Like, they're not attuned to that. So this program really makes me feel that as far as survival after, I'm being well cared for. That it takes that type of program to really make you feel that you are that well cared for, that your cancer is being monitored, that someone that knows what they're doing is really following you. And it's also a support group. Like, they manage all your needs. You can see they have I forget what it's called, like a social work clinic where they're managing your emotional stability as well, not just medicinally, but your emotional, your financial. It's constant questions, constant everything. It's very comprehensive, and it's very great to be a part of. And I'm so glad that they took me into that program, or else I'd feel kind of lost in the transition from young adult to surviving with cancer.
Chris, I know your experience was a little different, so.
My experience is very different. As one of the slides we saw this morning, thyroid cancer accounts for more than half of all young adult cancer cases. But again, we don't get an oncologist and an endocrinologist who's more concerned about the type 1 diabetic in the waiting room isn't going to remember to tell you that there's a support group for thyroid cancer. So, I had absolutely nothing for the first 2.5 years of going through living with cancer and trying to understand what it was like to turn 30 and still have cancer that I was too young to have, that now we couldn't cure. And I finally found a young adult support group on my own through using the internet, and it was Stupid Cancer, which is how I met Ben. And through there, then I finally found the Thyroid Cancer Survivors Association and started doing those support group meetings. But for the young adult thyroid cancer community, it's very lonely because we're told it's not a real cancer. It shouldn't be considered a real cancer. We don't even get a real cancer doctor. So we don't feel like we can reach out for support. And when we do, everyone is very welcoming, but it's hard enough to go to a cancer support group. It's hard enough when the medical community makes you feel like you don't have a legitimate cancer. So I can't really speak about how the AYA movement has changed over the last 5 years because there is no AYA movement in thyroid cancer.
Can you talk a little bit more about your follow-up care experience and your sort of daily and monthly grind?
I average 175 doctor's appointments a year. That is between an endocrinologist, a primary care physician, a cardiologist, a therapist, because trust me, it gets a little daunting, a gastroenterologist, an ophthalmologist, because we have to manage all these side effects. I'm now insulin dependent, so I have to have that yearly eye exam. The heart condition is, my resting heart rate is like 120. That's pretty bad. And it's just, I have not worked in 5 years. I can't work. Because what are you going to do when you get a phone call at work on a Thursday afternoon that something is really wrong with your blood work and you need to be at the hospital the next morning to have an emergency MRI? What employer do you know who is going to let someone take off 4 hours of work every other day to manage this cancer? So, I spend an average of $15,000 a year out of pocket. That is with my insurance covering 90%. Again, I don't have a case manager because I don't have one of those real cancers. So I'm the one who's finding all of my specialists. I'm the one who's remembering that I've been on hormone replacement therapy for 5 years. It's time for a bone density scan because that's one of the side effects is density loss when you're on thyroid hormone replacement for so long. I'm the one who has to remind the doctor that it's time for my yearly ultrasound. And remember, it's this lymph node here that we want to watch, not this one here. And that gets very exhausting. So the doctor forgets something very simple, like the fact that my Adderall has to be hand signed. I will have a total meltdown because it's exhausting to have done this for 5 years on my own.
So the out-of-pocket costs there are pretty extreme, and I think that we talked a lot and have brought up a lot today about the financial burden on young adults. And I'm curious, well, so I know that a couple of you, Holly, you had parts that were not paid for out-of-pocket costs. When you have these things that come up, how do you evaluate what's worth it? And we know a lot of young adults have to make these decisions about paying for rent or getting their prescription, or how do you evaluate what's worth paying for out-of-pocket?
This story is not going to be one of those critical ones. It's not that big a deal in the scheme of things. I'm a very frugal person. I blog about my frugality and my free riding. I go on what I call mansion hopping. I house sit at these different giant houses in DC, one after the other. It's pretty fun. Gets kind of tiring being like a nomad. But so I wear a 2.25-inch lift in my left shoe because my ilium was removed and my femur shifted up until it hit scar tissue and didn't move anymore. And insurance companies used to always consider this not medically necessary for me to have a shoe lift. So instead of walking around on my tippy toes all the time, I would dish out some money for shoes. Now, I don't buy too many shoes, but I would have to decide which ones to get. So it's really an issue of functionality. You need one pair of black dress shoes, brown dress shoes, sandals, sneakers, and then that's pretty much it. At $250 a pop, it was not worth it for me to go much further than that. So that's the trade-off I had to make. Yeah, so insurance never covered it. Now, my last insurance did, so I went crazy on buying shoes. So now I have a solid 8-ish pairs.
So I'm going to go ahead and touch on that as well. Totally different, although I'd have a lot more shoes, but benefit. So for me, paying out of pocket, I recently, this kind of is twofold, but it goes back to my fertility issue. After my treatment, I guess Dr. Levine discussed it earlier too, that you're not well aware of what you can do in terms of fertility it's not like Ben. It's much more complicated for a female, and I didn't have the time, nor did I really understand. And my oncologist said, you're kind of still young, so I really wouldn't put too much emphasis on it. And at 25, having babies wasn't really at the forefront of my mind, but it was something I definitely wanted. It turns out after treatment, I went postmenopausal, and had been for since post-treatment in 2006 till about 6 months ago. I had been told I'd had no menstruation, no cycle, no nothing, just hot flashes. Went on some hormone replacement therapy, went off of it. You're done. I went and saw a fertility specialist, and all my FSH, everything came back postmenopausal, blah, blah, blah. So 6 months ago, I started feeling kind of like crappy, and I thought that I needed to change my thyroid medication, talk to my primary care doctor, and he checked out, let me back up, saw my gynecologist. We discussed it, and we discussed that, I'm in premature ovarian failure. It's done, you're done. And because I have a family history of ovarian cancer, my grandmother deceased from it, and my aunt, fortunately, has survived it and is doing great. he recommended that I have my ovaries probably removed because your incidence for ovarian cancer, have them removed before you're 40. Basically, they don't work, so you may want to think about just taking them out. Okay, I'll think about it. Thought about it, thought maybe I should do it, then thought it's another surgery, maybe I'll just wait. What's the big deal? Fast forward to what I was just speaking about. I felt bad, thought it was my thyroid, thought I should get it checked. Maybe I should up my medication for the thyroid. Talked to my primary care doctor who recommended this treatment. It's called bioidentical testosterone pellet therapy. And I'd never heard of it, had no idea. And he says, but he said, there's great studies, sent me the studies. He said, I think this is good for you. You're not making, we actually tested my hormones. I wasn't making any estrogen. He said, that's probably why you're feeling horrible. You're not making any testosterone. You're not really making anything. This could all be a contributor because I was tired, exhausted, and no one had actually checked my entire hormone panel or whatever you want to call it. I don't know the proper term, but I said, okay, I'll try it. And he says, well, it's $500. And I said, okay, well, maybe my insurance will pay for it. He says it doesn't. It'll cover it for males, but it won't cover it for females. So it's $500 for this treatment. And I said, well, I'll try it. Fortunately, I was able to try it. I have a great job with flexible spending. If I didn't have that, I wouldn't be paying $500 because it's $500 every 3 to 4 months. So I said, well, let me just give it a try. So I did it, and I truly believe it worked. I felt much better. I wasn't exhausted all the time. I actually felt like I could concentrate. It was doing good. So I did it again. And after the second time, I started talking to my doctor. I started in June of last year. Yeah, June of last year. And I did it again. I'm sorry, excuse me, December of last year. Then I did it again in March. And actually, I'm getting my dates all confused. Either way, long story short, in January, after my first cycle, I started getting a period. And then I was like, that's kind of weird. He said it could be normal, your body's just, reacting. Anyway, ever since January, I've had a period every single month. And my estrogen that started at 23 is now at a normal range of like 240 or something. And they think that the testosterone, that something was masked and that maybe the testosterone pellet therapy has brought it out, but I'm having a normal cycle, I'm luteinizing, everything is back to normal, like I've never had menopause before in my life. So hopefully there is hope that I will one day be able to have a child, right? But I was watching all the charts and it's kind of diminishes as you get older. But I guess the point that I'm trying to make here is if I didn't have flexible spending and I didn't have that opportunity, for 5 years I thought I was menopausal, never having kids, which is an emotional, very emotional toll, especially for a female at that age. Giant roller coaster. But now I might have that opportunity. I wouldn't have known if I hadn't tried this therapy, but I also wouldn't have known if I didn't have the money or the means to do it. And at 25 and at really any age, unless these things are covered, you're not going to try them. It's just, it would stink for someone that didn't have the means to do that, to go on, have their ovaries removed, never knowing, never trying. And it stinks that it's covered for men because it's more important, testosterone for men, but women actually make testosterone as well. And it's very important to me now. I'm not on it anymore because now I'm cycling normal, but I think it's an avenue for one, fertility, for two, for policy to make these types of things affordable or feasible or covered by insurance.
So one of the other big issues that I think Brad touched on today was isolation and peer support. And I know that isolation is one of the overwhelming challenges facing young adults, and peer support is incredibly beneficial. I know also from talking to a lot of medical professionals that it can be very challenging to get young adults to a group or some sort of peer support gathering. And I know that each of you sort of came at that in different ways. And so, but you're all have sort of said the same thing in our conversations about sort of the traditional model maybe not quite working. So can you talk a little bit about your experience of that isolation and sort of how you solve that problem for yourself, and then maybe how you would recommend to the healthcare community sort of broader some recommendations on how you can make that better, how they should adjust the approach. perhaps for young adults?
So I didn't attend my first support group till the summer of 2010, and I was diagnosed back in 2008. It took me a while. It took a therapist saying, you can't do this alone. So my first support group was a head and neck cancer support group, to which everyone in the thyroid cancer community was like, oh no, you can't go. They're way sicker than you are. And I was the same age as these people's grandkids and great grandkids. Seriously, I was half the age of the facilitator. And she was the only one who, wasn't in menopause yet. And that was hard, but it helped because for some reason, having these little old ladies around me helped me to finally talk and open up. And from there, I finally started trying to relate to people that were in my own age group. And then I finally started to relate to people with my own diagnosis. So, it's kind of a backwards way of doing it, but that's how I had to do it. And it is different for the young adults. Stupid cancers, it focuses more on socializing. They don't meet in hospital settings. They meet in restaurants or movie theaters, and they just socialize. And sometimes the cancer's talked about, sometimes the cancer's not. I think I was one of the first people to know when Ben switched jobs because of that. But I run my own support group for thyroid cancer, and it turned out to be all young adult women my age. But we meet in a hospital, and we talk about what's going on and how to cope with the diagnosis and how you accept it. But the hardest part I have is actually getting the people to come. And I tell them, if you have to bring a healthy friend, bring a healthy friend or a caregiver or someone who supports you and has your back. And I don't know, Holly, you want to?
I too went to a support group one time when I was first diagnosed, and it was my first and last time because I went. It was nice, and then I got an email 3 days later saying that one of the girls that I just met had passed, and that was devastating, especially when you're in treatment and you're still unsure of where you are and what you're doing and if you're going to live or not. But as far as how to reach out to the AYA population, social networking is really giant. It's huge. Facebook, Twitter. There's all these new ones now. I'm not even up to date on them, but ask your kids; they'll all know. YouTube. It's just a different avenue. And for me, when I was going through treatment, I wasn't on Facebook yet. I didn't even have an iPhone. It was just, I guess all of us really, there was not really social media going on when we were in treatment, but now it is. And so I would imagine that when these kids are in treatment and young adults, that's what they're doing. So that they're on their iPhone, they're on their iPad, they're Googling. That's the way I think that the focus needs to tend to. And as for support groups, I think that they're wonderfully beneficial now that I'm out of treatment. I've been to several for different type of cancers, not just mine. There really isn't one for Wilms tumor. They don't speak yet. But I have been for a bunch of different types of cancer, and I think they're great, especially for certain people that can really relate.
Do you think, Holly, that the being on Facebook and meeting people through that and through social media then sort of opened you up more to the idea of an in-person group?
Yeah, absolutely. And I guess we had talked about that, so I'm glad you reminded me. But I was telling Heidi that I didn't have Facebook when we were going through treatment, so there wasn't that there. But now, when I have my yearly scan, or when I have great news, or I'm celebrating, I just recently celebrated my 8 years on the 13th of June. So I posted that on Facebook saying, I'm still here, 8 years, woohoo. And you post certain things about your journey, whatever. And that opened up a lot of doors for a lot of friends of friends. Just me putting that on Facebook, the next thing I knew, not just this recent one, but over the past few years, friends of friends in high school have come out saying, hi, I'm so-and-so, I'm friends with so-and-so, and they said that you had cancer, I have breast cancer, I'm only 26, can you talk to me? Of course. And that to me is more support for myself than probably even for them. It just makes me feel like I'm giving back. And just, it's amazing how far-reaching Facebook and Twitter and all that is, because I became so many friends with people that I didn't really know that well, but now that they had cancer and I had cancer, we're cool. Yeah, it's very beneficial.
I think I represent a very small portion of patients who I like to call myself a quasi-sociopath. I was this rebellious 16-year-old. I became emotionally detached from cancer, and I actually, as a defense mechanism, I looked down on other patients. I felt that I was better than them. I felt that I was better than everybody, including anybody who showed emotion, anybody who cried. It was just my way of feeling this sense of esteem and confidence and superhuman aura. So I didn't reach out to anyone when I was a teenager. Other patients seemed to have fun, and I just pushed them away. Years later, when I wrote my book, I reached out to the mother of one of the patients who had died, and she told me stories about him. We were sort of, friendly in the treatment room, but I never did anything beyond that. His name was Matt, and he had met this guy, Charlie. The two of them lived on the campus at the Children's Inn, and they didn't know each other before treatment, but they became best friends, and they did everything together. And his mom would tell me stories like after chemo, they would drive to Krispy Kreme and pack the car with everyone willing to go, and they would each eat a dozen donuts and puke their brains out on the way home. Or they once took this boy who was 15, and he had to have his eyes removed from cancer just before his license, so he was really pissed off about that. So on Christmas, when the lot was deserted, they put him in the driver's seat and let him drive around a car. And looking back on it, I missed out on this support because of this mindset that I had. I don't regret it because, you change one thing, who knows what happens. But there's no question that I missed out on awesome friendships and rewarding experiences. But even today, I can't go to what I think of as a typical support group. There's sort of this tug of war with me trying to be, a productive young adult, and then also thinking back to how that 16-year-old Ben would view me. And if I went to these support groups, I know that he would feel a sense of shame. So I do seek support in unique ways. I just don't call it support. Social gatherings, that's the way to do it without labeling it anything. Or adventure trips through First Descents. It's an organization that sends young survivors on free trips. That and Birthright Israel, I'll do anything for free. So I think there is a small group of people like me. Particularly, it's probably males, probably in that adolescent age range. And they're probably not getting any notice. I would imagine social workers look at them like they looked at me, and we have this look of get the F away from me, and then that's it, But if I was offered the opportunity to go hang out with Matt and Charlie without being at labeled support, just go to a Redskins game or the movies, I think maybe I would have done it. So that would be my recommendation for at least some of the younger patients out there.
So you have to be tricked into it, basically. Going back to talking about social networking and online the online life and how young adults are so that's such a pervasive part of young adulthood nowadays. That's where you live. You live on Facebook. You live online. You live on YouTube and LinkedIn and Twitter and there was some great conversation first thing this morning, I think, about how we get a lot of conversation actually about how do we get young adults to participate in research. And there was a lot of talk about online mechanisms and web surveys and a prospective database or a platform like Smart Patients where people would go and share their information. And I think it's kind of the Wild West right now, and especially with this really hard to reach population, there's a lot of opportunity and there are a lot of unknowns. So I guess my question would be, what would what would make you want to participate in something like that, like a platform, some sort of agreeing to participate in sort of larger scale research or any research for that matter? If you could talk a little bit about what would make you want to engage in that or participate in it, and then maybe what would prevent you from doing so.
Money would incentivize me to do it. Give me an Amazon gift card. I'm all over it. Doesn't even have to be much.
How much is not very much?
$3. So I'm sure all of you get tons of email to the point where you unsubscribe from all kinds of listings, and it becomes a full-time job to reduce your email. I get a ton, and I don't like it, so I often delete it, don't pay attention. Unfortunately, surveys are in that grouping. Now, I do give more value to surveys like the ones that we're referring to, because I feel, a sense of responsibility. But I think money, without question, would be the easiest way.
And on that note, we were discussing earlier how I was just saying how I think it's different. Incentivizing the different, you just have a broad spectrum, 15 to 39 of AYA population. A 39-year-old isn't going to be as impressed with a $25 gift card to Amazon as is an 18-year-old boy or Ben, right? So I think it's different, and I don't have the answer on how to incentivize the older population, but definitely the younger population. I mean, money, it talks, right? And personally, I mean, I would fill it out just because I feel obligated to try and help, to try and, make this research go further, because this research is great. It's awesome. It's very influential. But my question is now is, what are you doing with it? Like, how do you make something out of it? How do you make it work?
Do you think it matters who asks?
To me personally, no. I mean, if anyone sends me some cancer or anything, of course I'm going to fill it out. I'm grateful to be here to be able to fill it out. So I feel like if I can do that, then I would expect everyone else to be able to. But it's obviously not that easy. And like Ben said, email, I delete a lot, so it's that easy. Is snail mail the right way, as opposed to email? I don't know. I might pay attention more if something's mailed to me, especially with the bracelet, right? Or a gift card. I would still take it. I would do it.
I think it's also important, we were discussing earlier, the language. If you would like the young adults to be more responsive, word it the way that we talk. I mean, granted, there's going to have to be medical terms in it, but if you can spell otolaryngologist when you're 28 years old, you can handle a little bit of medical jargon. But just remember who your audience is. Relate to us. And I do actually think that it matters who the survey is by. I will be more likely to do a survey from a hospital or an institution like Livestrong than I'm going to be from, Jones School's 501c3 that he just established, the night before. When I do my surveys, I usually find them on Twitter, believe it or not. They just come across my Twitter screen. I'll be like, oh, I have 5 minutes. I know this organization. They're good. I'll give them my opinion. So that's just what I would add to when you're redesigning your surveys.
I want to go back to something that you said, Holly, which was about you're grateful for being here and sort of that's you would fill it out. It sounds like to help people who would come after you. Do you think that's a good motivation, that a lot of people are motivated by this element of giving back, and that's a sort of a good incentive for promoting something like that?
Yes, I personally would hope so, but based on the results of the surveys, I guess it's not a good motivator, because if they've all had cancer and they're not responding, then then I'm not that hopeful that they're going to respond. Otherwise, we'd have a much better cohort and many more surveys filled out and that much more research. For me, I don't know. Everyone's different and they all respond differently. Some people want to have cancer and forget that they ever had it and be done with it, not want to look back, just want to move forward, don't think about recurrence, I don't want to see the survey because it's just reminiscent of my treatment. For me, I'll fill out anything you give me if it helps somebody else and if it helps someone, anybody, researcher, patient, doctor. I think it's important to know from the source, like what you're really doing really either matters or it doesn't, or I don't really care, because that's how most surveys are: non-applicable, don't care, somewhat care. And sometimes the questions are quite redundant. Like we were talking about earlier, like when you ask the same question 12 times, 12 different ways, sometimes you see right through that and you're just bored, done. You check out. In terms of support, I think I'll do any survey that especially facilitates support for AYA. Support meaning like support groups and stuff like that, because I think it's extremely important. And I think that AYA is lost in the shuffle of old adults, end of life, young pediatrics, full of life, and you're just kind of in the middle. And for me, when I was going through treatment, I had nobody, like none of my friends had been diagnosed with cancer. And I say yet because I was the first, and unfortunately there was soon to follow. But not having one person to even, my support team was the nurses at my oncology office. We were the same age. Like I had the most fun with them, and thankfully they were nurses, they knew what they were doing, and they became my friends. So that, to me, turned out to be a bigger support group than the support group I had to attend. It's extremely important at that age, at our ages of diagnosis, to have somebody to turn to talk about things that are difficult to talk about with your 60-year-old oncologist.
So I think another thing too is the patients that are filling out your surveys are the patients like Holly who have come to accept their cancer diagnosis. They have embraced the positive aspects of their cancer diagnosis, and they want to give back and they want to better the community for the next generation. Not everyone in this age group is at that place. They're still struggling because their psychosocial needs were not met during their treatment, so they don't ever want to think about it. They don't want to deal with it. They're still in that chronic level of distress because no one's helped them with it. Doesn't matter what you do, you're not going to be able to reach those patients. So it all comes back to if they get better care during their treatment, you're going to get those results you want in the end.
If you get better care during your treatment, there was a comment earlier, I think, about it being engaged, right, as an active participant.
Right. If the medical community takes better care of us, we're going to want to give back and take better care of the next person to get diagnosed.
So I want to switch gears just a little bit and talk about that transition back into work and to school. And I know, Holly, you had a sort of interesting transition at the as you had to stop working and then go back into work, which I think has some interesting implications.
So I was working at the time of my diagnosis, and soon after I was diagnosed, I went on short-term disability because my treatment plan was pretty intense, and I was told I should probably try and stop working. Unfortunately, I had short-term disability, which then turned into long-term disability after a certain time frame. My long-term disability, the underwriter for the long-term disability requires that you file for Social Security disability. It's a requirement that they have written into our policy. And I said, I told my work, I don't want to delve into that. Like, that's just a mess. Like, I'll be back to work, whatever. They're like, it's a requirement, you have to do it, but don't worry, you won't get approved. It's so hard, like, don't even worry about it. Okay. So I started the Social Security process, which at 25, all I know is I have a Social Security card, and I don't have to worry about Social Security till I'm older than my parents. And my parents don't even know that much about it. So go fill out this paperwork, which was the most arduous paperwork I've ever seen in my life. And it was just back and forth, and it was exhausting. That was one of the things, like you were talking about, it was just exhausting trying to fill this out. I don't care. I don't want it, but you're making me do this. And you have to notify your doctors. Your doctors have to send in stuff, and it takes them a couple of days to get your report. And can you send it again? You didn't sign this. It took like 2.5 months just to get my application submitted. And then they wrote back and said, well, you're going to need to discuss this kind of, you're going to have to see one of our doctors as well. Oh, so you don't believe my doctor? Like, okay, sure I will. And then I get a letter a month later saying, you've been approved for Social Security. And I said, great, I guess. What does that mean? It means that they're going to send you a check every month because you're now deemed disabled. The process of getting Social Security at 25 was a joke. Like, it was so, I hope I never have to fill it out for my parents. I hope I'm done with it. I'm over it. It worked. I got lucky and they gave me disability, which was great. I was only on it for like 3 months after the entire process because I was able to go back to work. So after 4 months of trying to fill out the paperwork and send it for them to accept it, I was only on it for a couple months. I returned to work, and when I did go to return to work, my work didn't know what to do with me because they've never had anyone come back with from long-term disability. They couldn't believe I was approved by Social Security, and they've never had anyone return. So that kind of turned into a workplace, like a bit of an adjustment for our HR. And they were embarrassed to say, we don't know how to turn all your stuff back on and get you back into the workforce. And I said, well, I already notified Social Security that this is my start date. And I went back to work and I was fine. I kept getting Social Security checks. So I called Social Security and I said, I'm back to work. I'm not disabled. Oh, well, once you're disabled, you're always disabled. You'll always have Medicare. And I'm like, well, wait, you're still paying me and I'm working. Like, I don't need, sure, I'll take your money, but I don't need it. Like, and they explained to me that they have this 6 month, it may have changed by now, but this is 6 years, 7 years ago. And I said, well, I'm working. And they said, yeah, well, we have a 6 month trial period. So for 6 months, you'll still get paid your Social Security on top of your regular salary. And then if everything works out, then we'll stop it. Well, to me, that's a whole different subject. To me, it was a waste of tax money, a waste of everything. I was working, I'm insured. I want less paperwork. I don't need it. And I think it's great for people that do need it. Great. But I was back to work full time. I don't need it. I didn't need the hassle of having to fill it out. So that somewhere, and actually it reminds me of something I took in the notes, is it's an unmet need, right? There's someone discussed financial counselor, something else. These are unmet needs. At 25, I needed someone to tell me how to fill out this paperwork and what does taxable and non-taxable mean, and because you still get taxed on your Social Security. So at the end of the year, my tax statement said I had to pay taxes on the Social Security that I didn't want anyway. So that was an unmet need for me, and having someone with that financial counselor or social worker who has experience in that would have really helped greatly and probably saved me a month in trying to fill out this paperwork and provide the required documentation. And I think that for people that at that age group that are young, that don't know what Social Security is and don't know what you're really asking for, I think it's important that somebody help them along the way to know what they're doing.
If anyone has questions, please just come forth to the microphone.
I have a question. That was an easy move for me. I'm Sarah from Livestrong Foundation, and thank you so much for coming here. This is really an important part of this workshop, and I'm very glad that all three of you are here. Something that two of you talked about was your allegiance to or affinity with your provider and how that seemed to trump the setting within which you were treated. Could you talk a little bit more about that allegiance? Had you seen more than one oncologist? What fostered this allegiance, and how did that maybe help you make the decisions about where you're going to be treated and how you will be throughout the rest of your lives?
I'll provide an example. Recently, I've considered moving on from hanging out with the 6-year-olds. And so I've been seeing adult specialists. I don't really have much use for general practitioner, but I have seen some adult specialists, like an adult endocrinologist, for example. So I take a supplement to keep one of my hormones in a normal level. And I saw an endocrinologist to look at the range and see if I was in it, see if he wanted to change the dosage. And he suggested stopping it altogether. And I was going to do that. I'm all about shedding possessions and unnecessary medications. And then I reached out to a former endocrinologist who saw me at the Children's Late Effects Clinic. And she let me know that this drug, that's fine for someone who had never had cancer treatment, but for someone who's had cancer treatment, it has a wide-ranging effects, like it keeps your bone density in a certain level, and it has benefits beyond just what you think of when you think of that hormone. So that made me realize that the AYA cancer group has to be considered in like a different health category almost. We can't really see normal doctors. They don't understand the system that's required. If you take one piece of it away, then how's that going to affect all the other things? Was that your question at all?
Say what you will question.
Okay, so yes, I am very loyal to my doctor, because now that I've seen what happens if you try to tamper with going to non-cancer specialists or a non-team approach, they don't understand that we did have all this treatment that affects us in so many different ways. So I'm going to stick with her until she moves on to TAC, or until I get tired of playing puzzles.
Yeah, I still see my surgeon every October. We have a cake together to celebrate another year. And the difference is that he's not going to operate on me again, but he cared. And so that personal touch, relating to us, holding our hand, will stick with you for life. Whether we need you again or not, you won't be able to shake us if you give us that one-on-one care.
For me, it was completely vain. My oncologist was a female, and her nurse practitioner came in first, and she had on this great outfit. And the first time I ever met her, we just started talking about clothes, and I wasn't talking about cancer, and I just felt so relaxed with the nurse practitioner. And then she was like, "Oh, wait till you see the doctor. She's worse than me." And she came in and said, "I love your shoes." And I said, "Thanks." She was like, "These are my Jimmy Choos." And I was like, "Oh my gosh, is this happening?" And then she that's how it started. And I was like, I like this place. And I saw some of the nurses, like they were just very friendly. But this is before we knew I was not having the right cancer, but she was very blunt, yet comforting and soothing. Like everything about her and her nurse practitioner just made me feel comfortable, made me feel at ease, and made me feel like this is where I needed to be, because she's soothing to me. Like she's motherly in a way, and she's respectful, and she's a doctor, so she's obviously knowing what she's doing, right? So, and I liked her. So, shoes and good doctor. That's all I needed.
I would echo that we're very appreciative that you all have come and shared with us this afternoon. You know, if we all walk down the street to that Mexican bar or restaurant around the corner together, you all would not necessarily be picked out as somebody with cancer history. Even your hairstyle, Ben, because there are lots of young men without long locks, that wouldn't necessarily be a cue to anybody. So along the way, my guess is you've been in situations where you have chosen to disclose your history. And I'm curious, did you get any coaching from any healthcare providers about when that moment came, what that might be like, how to handle that? Did you get any of that kind of sort of transition coaching from going from maybe more in the healthcare arena to now I'm just on follow-up on some sort of basis? And if not, what message would you have for us?
So, for me, when I was going through treatment, I lost my hair. I lost my eyebrows, my eyelashes. I mean, you look like the typical cancer patient. At 25, wasn't very, it sucked. I mean, it just all around sucked. I toyed with wigs at first. I went out and bought like a blonde one. I'm going to have fun with this. Horrible. They're like the worst ever. They're itchy. It was summer. I wasted a lot of money. I've since donated, but I just went bald. And as far as I think I've already missed the point of your question, but
Well, it's how you look today. You're in a situation with people you didn't know as well, and conversation comes up, or you're getting into a closer relationship, whether it's with female friends or whether it's in a romantic relationship. Or did any of the health professionals even think to talk to you all about that?
yes, for me, yes. There's I know Inova Life with Cancer offers some different types of programs. The young adult group focuses on things like dating and intimacy and things that are definitely, I guess, things that you don't want to really talk about to your doctor about whatever. But as far as transition, there are programs out there, but I don't think anyone ever actually during treatment ever sat down with me and said anything to help make that transition. When my hair grew back, it was horrible. It was curly, but at that point, I was at this point where I have hair. This is great. Whether I like it or not, it's coming back. As far as healthcare professionals, I think that's definitely a great area to look into, because transitioning with a diverse age group from 15 to 39, a 35-year-old may not have hair to begin with, so he may not care. But at 17 and 18, when you're trying to be an impressionable college boy, that certainly could be a very large issue, and trying to discover your own self. I fortunately was at an age where where it didn't matter. Skin was in, so just go bald. Who cares? I don't know. Did you have anything?
So again, being the redheaded stepchild of the cancer community, no one talked to me at all. I'm allergic to every surgical glue, every surgical stitch. So this thing was nasty and keloided like you would not believe for 2 years. I couldn't go anywhere without the cashier screaming. I was accused of slitting my own throat when I was in the mental hospital. I would have just random strangers walk up to me while I was having dinner and be like, "Oh, I have a tracheotomy scar too." So I had 25 plastic reconstructive surgeries on this to try to minimize it. But, I've got a scar on the front of my throat. So if you get close to me, you're going to know that something was majorly wrong with me. I didn't lose all my hair at once. I lost it in chunks over the course of 2 years. So, that was great, because here I've got this long hair, but I've got this fro in the sunlight because it's, starting to grow back in. But no one talked to me about how to handle that. So, I was ashamed. I wore scarves. I'd wear turtlenecks in the summer. I know what the summers are like here. That's not fun. But I did everything. I was so ashamed. And no one was there to help me figure out how to navigate that.
My closest friend is a hemophiliac, and he acquired HIV when he was 3. He got AIDS when he was 6. We used to stay up all night talking about when to disclose it, how to disclose it, whether it's worth it. The truth is that I can't hide it. I have a limp. I now use crutches voluntarily on long-distance walks. And I'm also a public figure. You Google my name, you see all kinds of crazy things. This has definitely affected me dating-wise. Girls have seen me walk up to go to the restroom. They see my limp. Maybe it's just me being crazy, but after she doesn't talk to me the next day, my guess is that's it. Maybe that's just me covering up my crappy personality. I've also, my recommendation is that nobody talk to me about how to do it. I don't think there is a right way. I think people have to figure it out on their own. Fortunately for me, now that I'm a public figure, the choice is taken away. I don't have to care anymore. It is open for me. I can't hide it. Sometimes people knew who I meet. If I'm sitting in a bar, they obviously can't notice that something was wrong, and I will not mention it. And sometimes it is refreshing to just be seen without that stigma. My recommendation is to own it. I use crutches now, and you would think that it would make me feel sick. That was the driving factor throughout my entire life since cancer. I never wanted to be seen as the sick kid. Pretty much every decision I make is never to be seen as the sick kid. So you would think when I use crutches, I'm embracing the sick kid attitude. That was my fear at first, but actually, I go faster than everyone. I pass them. I look them in the eye. When I go up the escalators, I walk on the left, and I think, what are these people on the right standing thinking as I'm carrying crutches up the stairs? And this gives me this sense of arrogance. I know it's unethical, but again, this survival technique, it continues and it will persist. Kids probably don't see this. They feel self-conscious. I'm sure when I lost my hair, I wore a wool hat everywhere. I didn't want anyone to see that I was completely hairless. If we can create this cool factor that having cancer makes you different in this unique way, I think that would be awesome. Now, when I go to a bar and people share their stories, they often seem kind of the same to me, and mine is a little different. It makes me stand out, and I'm not saying my struggles are any worse than anyone else's. I'm not comparing them, but to me, it just makes me feel unique, and I own it. I own cancer. I own my cancer history, and it actually gives me this sense of strength.
I think we're about 5 minutes over, so that sounds like a pretty good place to stop, actually. So thank you, guys.
Well, thank you again to the panel and to all of you who've remained to hear the wonderful messaging from the panel. We will see you tomorrow morning at 7:45. 7:45. We begin at 8, I think. Oh, all right. Thank you very much.
Yes.